Life is a winding road, no telling where it goes. Driving through days and nights, won't stop for traffic lights. And I really wanna know, if I will ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down. Jumping from cliffs so high, trusting our wings to fly. Sometimes we're crashing down, but we get up and start from the ground. And I really wanna know, if I will ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high.
So the purpose of the Teen Think Tank Project is to empower teenagers by not only giving them a voice, but the tools and resources they need to flourish and make a positive impact in society.
One of the things that stood out to me right from the beginning was the amount of team building we did, as in getting to know our fellow research associates and becoming familiar in order to maximize our working strategies. For example, we started with the Belbin team role assessments and communication style assessments in order to really grasp what our communication styles are like and be able to work efficiently based on our preferences.
So for academic development, one of the very important things now that I'm getting ready to go off to college, I'm a senior in high school, is learning how to do real academic research. I feel in schools, they tell you to write a research paper and put it in MLA format, and you're not really given any feedback on it, besides the grade that you get at the end, and it's okay, let's move on to the next topic. Here at the Teen Think Tank Project, they really drilled that into our heads, how you conduct real research, the tedious process that is editing your research paper. I'm taking dual enrollment classes at a local college, and I was just recently working on a research paper, and my professor said, has anybody written like an actual research paper? And it was kind of cool to be in a class with people who are freshmen, sophomores, juniors, and even seniors in college who didn't raise their hand, but I was the senior in high school who raised their hand because I wrote a real research paper.
And what I'll share with you, from the perspective of being a parent to these kids that are, in high school. And I'll speak to Samir first, who's my current 12th grader. He is, eyeball deep in college applications, and the opportunity this has provided to differentiate himself, to stretch his thinking, his leadership, to come across in a college essay or a college interview as somebody that's working on something from, essentially side by side with Matt and Kelly from the ground up, figuring it out as you go, leading as you go, having access to experts, in these industries, being comfortable communicating. You get more than your traditional experience, whether you're on a debate team or, kind of doing Project UN or, all initiatives which are important, I think, can help supplement. But in terms of this being a unique, opportunity, I fully support that notion.
Administration. So the stuff you guys are learning, I didn't really dive into that until I was a master's student. So I commend you all for that.
And I'm looking forward to each one of you somehow contributing in huge, big ways. Your generation, it's where it's at.
Yes, this generation is certainly where it's at. And we are lucky enough to be working with these high potential teens. My name is Matt DeSantis. And on behalf of the Teen Think Tank Project staff and coworkers, Kelly Nagel, Bernadette Sheehan, our partners, our friends, alumni, parents, educators, everybody who's joined us here today. Thank you very much. Thank you for joining us. Thank you for supporting these teens. Thank you for providing the ears in which their voices will speak to tonight. This is the fourth Teen Think Tank Project policy framework launch. It's the fourth one we've done in the last year. Our first one was April 17th. So it's just over a year now. And every time we do one of these, individuals say the same thing. That's awesome. That's really cool that you guys do that. And my response to them every time is exactly the same. No, it's not. It kind of sucks because every time our high potential teen change agents try to propose a solution to a societal problem, they turn around and there's a queue full of problems that they need to address right after that. These poor teenagers don't get a break. But luckily for us, they are up for the task. The agenda for this evening is pretty straightforward. Our cohort's going to show us where we went wrong as a society. And more importantly, they are going to show us what we need to be thinking about in order to change the trajectory of our society. But I'm not the one with answers. They are the ones with the answers. They are the ones who put in all of their time, effort, and hard work. Therefore, I'm going to turn it over to them because they are the stars of this evening's presentation. So, Moksh Patwari, take it away.
Thank you, Matt. So I'm really happy to be welcoming you all to our presentation today. And I'll take you through kind of what we have planned for today. So we're going to introduce ourselves. Then we're going to introduce what we worked on and our subject matters. Then we're going to get to the chunk of what we're doing, which is talking about our policy paper and all the work we've done over the past months. We're going to recognize all the speakers that lent their time to us to help us learn and write that paper. We're going to introduce a community impact award and present our scholarship awards. Then we're going to have a Q&A, and that will conclude our presentation today. So I will hand it over to Riya for our cohort introductions.
Hi, everyone. Thank you so much for taking time out of your evening to join this webinar. So this cohort, the winter cohort of 2022, we focused on health equity. And like Matt said, there were no shortage of problems. But before we get into everything that we have worked on over these past few months, there's a little video that we've compiled about our thoughts and what we took away from this experience. So I'll have Matt share that.
In order for change to take place, you have to have a change agent in position.
Hi, my name is Riya Mehta, and I'm a sophomore at Somerset County Vocational and Technical High School. I joined the Teen Think Tank because I was interested in learning more about something that I was genuinely and passionately interested about, healthcare inequality. I would like to use this experience in the future to encourage me to use whatever platform or whatever voice I have been given to try and change some things for the betterment of other people.
Hi there, my name is Kimia. I'm also a sophomore at Somerset County VoTech in Bridgewater, New Jersey. The current American healthcare system values profits over people, and this impacts so many lives along the way and continues to do so.
Hi, I'm Gianna Grasso, and I'm a junior at Colonia High School in Colonia, New Jersey, and I joined the think tank because I'm passionate about advocacy and the reforming of social issues. I hope that our paper opens the eyes of its readers and that it spearheads actual legal change regarding healthcare. I've learned throughout this process that healthcare is an unfair system that emphasizes profit more so than the actual well-being of patients.
Hi everyone, my name is Jeyven Chhina, and I'm a student at Mentor College in Toronto, Ontario, Canada. I've always wondered what the healthcare system is like for my neighbors down south, so I wanted to get some more info on it. I learned about the Teen Think Tank project located in New Jersey, and my interest sparked from there.
Hello, my name is Moksh Patwari. I am in 10th grade. I go to Somerset County Vocational Technical High School. And I joined the Teen Think Tank because I knew it would be a learning experience for me, and I would be able to get something done and really change the world through a policy framework and like actively work towards change.
Hi, everyone. My name is Leyla, and I am a sophomore at Thomas Edison Energy Smart Charter School. I joined the Teen Think Tank after hearing about it from a classmate who found the cohort to be a great opportunity to collaborate with others on a meaningful topic. I hope to overall spread awareness on the societal effort of reaching health equity. I've learned that healthcare lacks a great deal of transparency, and there are more flaws in the system than many would expect.
Hi, my name is Vaanya Salwan, and I am a freshman at the Somerset County Vocational and Technical School for the Academy of Health and Medical Sciences. I chose to join the Teen Think Tank project in an attempt to bring awareness to societal issues that I am passionate about, such as healthcare inequality. I also gained research skills and was able to work with a team. I feel that this experience will help me in the future, due not only to the skills that I gained, but also the connections and friendships that I made.
My name is Keara Field, a sophomore at Madonna High School and a research associate for the Teen Think Tank Project Health Equity Cohort. The reason I decided to join this cohort was because it was a really good opportunity for me to advocate for change in the medical field. And since being a part of this cohort, I've really gotten the chance to do that, and also forming different connections with the people around me.
Hi, my name is Avantika Malla from the Academy of Health and Medical Sciences at Somerset County Vocational and Technical School. I'm currently in 10th grade. I definitely think that the group of cohort members and, now I can say friends that I've created in Teen Think Tank are definitely very valuable. And I think that all the people and all the cohort members, I hope that they have a great future. And I think that they definitely will have a great future because they're all very great individuals.
The research that we did for the Teen Think Tank is something that's very personal. These are issues that affect actual people in real life. And we understand that it's hard to demonstrate the importance of those issues in the real world by just writing a research paper. So we decided to also present a collection of stories displaying the different issues in healthcare from the different perspectives, whether it be social, political, or economic.
As Keara said, we created a video showing 2 testimonials from doctors that are in the field, obviously, and here's that video.
This video will include 2 testimonials, one from Dr. Marklbert and the other from Dr. Pamela Souse. Let's begin with the first testimonial from Dr. Marklbert in the podcast, Here's the Problem, hosted by Kelly Nagel.
I'm curious, increase the screen.
What types of disparities have you seen, or how alarming are the disparities that you've seen through your career in the breast cancer space or the melanoma skin cancer space? Like, what are we talking about when we talk about disparities?
For those who don't know, melanoma is one of the most dangerous forms of skin cancer that occurs in melanocytes, otherwise known as the cells that produce melanin. This cancer is usually caused due to overexposure of UV radiation and can appear in irregular shaped moles and things as such.
Yeah, so I'll answer both melanoma and breast cancer. So melanoma, what we've come to realize is that even dermatologists are trained looking at, lesions and moles on very white skin. The textbooks that they use in medical school and going to get a dermatology degree don't adequately represent, diverse skin tones from very pale to very dark. They're primarily very white, patients with a mole or a skin lesion, and that's what dermatologists are trained on. And so that's a disparity. We need to make sure that the textbooks represent the entire human race and entire population, and train doctors and dermatologists. And so there's a fair amount of work going into refine and improve those. Similarly, in melanoma, skin cancer is a disease of primarily of sun exposure and UV irradiation, changing, lesions or moles on our body. And it is predominantly a white disease because people with darker skin tones are somewhat protected from UV radiation, but they still get melanoma. They still can get sunburn and sun damage and can get melanoma. But where skin of color, people with darker skins of color, they get other types of melanoma, for example, that are in sun-protected areas. They grow on the soles of their feet or inside their body in their mucous membranes, a subtype of melanoma called mucosal melanoma. And so racial and ethnic groups are disproportionately affected by these rare subtypes. And there just hasn't been enough investment to understand the biology of these rare subtypes of melanoma, what causes them, how do we understand them, how do we treat them? And so there's a lot of work that needs to be done there.
That concludes the first testimonial by Dr. Hurlbert. Now we'll be moving on to the second testimonial by Dr. Pamela Souse, a practicing optometric physician. In comparison to Dr. Hurlbert's testimonial, this testimonial talks more about insurance and how it can impede in patient-doctor relationships from time to time.
The insurance companies tend to control what I am allowed to prescribe and what I'm not allowed to prescribe. They will tell me if I prescribe something, they will deny it and tell me I have to try something else. And even if I try those already or I know they won't work, I still have to go through that before they'll approve whatever drop that I wanted to use in the first place. So then I have to have extra visits and let the patient suffer or deal with whatever they're dealing with for a longer period of time to prove that what the insurance company wants me to do is not what's going to work.
Yeah. And do you think that patients end up putting the blame on you then instead of the insurance company?
Some do, some don't. They get frustrated. They definitely get frustrated because it's a long process.
Yeah, for sure.
I mean, they're upset to begin with. They're paying all this money for the insurance. And then they're seeing the doctor, and then the doctor is not helping them because the doctor can't help them because they have a hand over them. So
So overall, it's just a lack of transparency.
Yeah, that could be it.
That concludes both testimonials. A big thank you to both Dr. Souse and Dr. Hurlbert. Let's move on to the next part of this presentation.
So, from the very beginning of our journey in the Teen Think Tank program, we divided our research into 3 separate parts: social, economic, and legal. Each member of these groups indulged in their own research on the subject matter and spoke to experts on these subjects, as you just saw. The research culminated into our final project, in which we have 9 of these essays to form and create a long and informative research paper about our healthcare policy.
So today we'll be talking about social, legal, and economic impediments. So ideally, in our research paper, the 9 of us worked collaboratively to make an entire paper with these 3 impediments. So we have to observe the array of social constructs pertaining to race and immigration status that create a barrier to health equity. Next, we have to investigate the economic impediments in the form of surprise costs of healthcare and the alarming deaths that arise for patients. And finally, we will examine the legal systems that allow the aforementioned impediments to successfully perpetuate. Okay, so Avantika, I think we can go on to social impediments.
So let's start by defining what social impediments basically are. And social impediments are any sort of impediment that relates to race or stereotypes, things that are created by society that can impede on way of life. That's basically what is defined as a social impediment. Now, the way that we wrote our paper was we began with defining systemic racism. So systemic racism is basically defined as a form of racism that is embedded in the laws and regulations of a society or an organization. And this can manifest in areas of criminal justice, employment, housing, healthcare, education, and political representation. Next, we're going to move on to how do these impediments begin and how do they develop? So they begin as childhood stereotypes. And the next part of our paper explains how humans tend to create stereotypes for each race, and they follow us from childhood to adulthood. And these biases are not usually taught, although they can be taught, racism can be taught, they are more likely adapted from surroundings. So we kind of adapt to how other people act and how they treat others. So next we can move on to how this like is measured. So there's a test called the implicit association test, and that test is basically given to anybody can take the test. And what the test is composed of is you have black or white, which means either white people or black people, and then there's a topics that are given, and people that are taking the test are told to put either 1 to black or 1 to white. And it seems that people automatically put white people on a pedestal in comparison to black people, who are more likely put on a are more likely considered to be negative or considered to be dangerous or evil. So because of these biases that develop through childhood, this can move on to when doctors apply to medical school and how they treat patients in the future. So when you have this bias that, black people are more likely to be brute or to take drugs perhaps, and then you have the other bias that white people are not likely to do so, you tend to be very closed-minded, and you make a lot of assumptions. So these assumptions can be very negative, and obviously assumptions are most likely incorrect. So especially in the healthcare field, everything has to be on an individual basis. Next, we can talk about how this bias infiltrates specifically the medical industry apart from the patient. So when you are going to be a doctor, you need to go through medical school, obviously, and to get through medical school, you need to be accepted. And these medical boards, the college boards, they tend to be mainly Caucasian, and those Caucasian people usually have a bias towards other white people. So they will most likely let white people in, and you can see this here. You can see that white people and Asian people are disproportionately let in comparison to other minorities. And this graph is from the AAMC data warehouse. Going back to this. So now that we have more Caucasian people or more white people and Asian people, which are a model minority, that are becoming doctors, the same biases keep on perpetuating because we have a lack of diversity. Next, we can also talk about diseases based on environmental adaptation. So environmental adaptation is basically, environmental adaptations are adaptations towards towards the external environment. So they're not diseases that are based on like genetics and congenital things, although some can be, but there are things like asthma, diabetes, and high blood pressure. So high blood pressure, diabetes, and asthma are all examples of diseases that are usually categorized for Black people or people of Hispanic heritage, whereas this is actually incorrect. Diabetes and high blood pressure are normally caused because of the conditions that they go through. So if you take a look at how Black people live in America, they are usually on the poorer side. They don't have access to high quality food generally. So that tends to give them, that tends to predispose them to high blood pressure. And doctors who teach that Black people are predisposed to high blood pressure out of nowhere are not understanding that it is an environmental adaptation. So the only solution to this issue would be to help make the medical field more inclusive, to help put a more diverse staff on the medical college boards, and to also help diversify the doctors in general. So that would be the social impediments. Next, we're going to move on to economic impediments by Leyla.
So the unethical practices rooted inside the healthcare system are especially visible within the sector of insurance planning. This is placing a tremendous downward pressure on individuals and families. So as a result of that, American utilization of health services is being affected more by economics than true care for well-being. Health service insurance plans are regulated by the states, meaning regulatory practices vary from state to state. We're seeing a perfect storm of negative economic trends threatening working families in the United States. So while gas prices and food prices are increasing, home values are declining, and the rise in healthcare costs is surpassing income growth, and fewer people have adequate insurance. Because of that, working people are struggling to pay their bills and acquiring medical debt, which is the biggest economic impediment issue. So regulation. Medicare is regulated at the federal level, and Medicaid is regulated at the federal and state governmental level. So rising costs could be due to hospitalization, medicine, or doctor consultation fees, which causes Americans to go into debt daily. According to the Center for Medicare and Medicaid Services, U.S. healthcare spending grew 9.7% in 2020, reaching $4.1 trillion or $12,530 per person. As a share of the nation's gross domestic product, health spending accounted for 19.7%. While government-regulated organizations serve citizens once they're in a health accident, what about transparency in healthcare coverage prior to any incidents at all? The Public Health Service Act, a United States federal law enacted in 1944, addressed that transparency in health coverage and imposes certain reporting and disclosure requirements for health plans that are seeking certification as qualified health plans. The transparency in coverage defined in that section requires health plans and insurers to disclose financial and economic information to participants, beneficiaries, and enrollees. In a well-functioning system, consumers should be able to observe price and quality differences when making a choice in their healthcare services. When insured patients are informed that their provider has charged more than the patient expects, a downfall occurs in the family's economic stability. Surprise billing is just an example of that, which is especially common in ambulance services and emergency department visits, which furthers the cost of insurance companies' poor regulation, since the patients can't choose the quality of their healthcare at all. The Obama administration found that increased insurance coverage and hence improved healthcare is likely to increase labor supply by reducing disability and absenteeism in the workplace. This increase in labor supply would tend to increase GDP and reduce the budget deficit. Increasing the labor supply would also improve the functioning of the labor market. So just as there was an economic problem, there could be an economic solution to the labor supply. Thank you.
So for this topic, something that we really have to discuss is the impact that funding has on healthcare. So just for some background, America spends a lot on healthcare. Our GDP is almost double of several developed countries such as Australia, and we are spending triple the amount that countries like Switzerland, which has universal healthcare, is spending on healthcare. So this brings on the question of, if we're spending so much on healthcare, why is it so inaccessible, expensive, and inefficient? Something that we also need to talk about is nonprofits versus for-profits, which are typically the two main healthcare facilities that we'll see. The major difference between these two is that nonprofits will receive a tax-exempt status from providing charitable contributions, whereas for-profits can charge freely to get money. The issue is that nonprofits are typically set up in wealthy areas, while for-profits are seen in low-income areas. So the low-income residents that might need those charitable contribution and those lower costs don't necessarily get it because they're not living in that area. And also there is a lot of sources that show examples of nonprofits not necessarily following through with their charitable promises, and
doing other things with their money, such as, building new buildings and putting in a more elegant architecture in their buildings. But another thing about nonprofits is that statistically, they have a better record of results from care and having better outcomes than for-profits. And this is likely due to the fact that they actually get the opportunity to focus on care, and there aren't so much thinking about money, unlike for-profits. And what do we all get from this is that a lot of time when you go into healthcare, just based on like how funding is done in the healthcare system, the care you will receive and the outcomes of your care are already predetermined just based on the healthcare facility that you're stepping inside. And this is primarily an issue for disadvantaged low-income individuals because who are unable to afford or access those better and preferred facilities. For healthcare, there are several decisions that go into where you decide to receive your healthcare. There's the cleanliness of the building, how far it is from your home, the cost, how good are the doctors and their machinery. But for a lot of low-income individuals, for them, it just really comes down to, are they going to be able to afford it, and is it within easy access? So basically, we're living in a healthcare system that allows rich people to get rich, and they can get proper care while the poor people suffer. Thank you.
Okay, so I'll start off with legal impediments now to close up our 3 impediments that we talked about for health inequity. Now, first, I'll go over the role of the American government. So living in America, the American healthcare system is obviously going to be guided by the American government and therefore is mandated by its laws and its activities. So the focuses that we will be having today will be on pharmaceutical companies and Medicare and Medicaid. Although we did discuss Medicare and Medicaid, we'll go a little bit deeper into it. So the pharmaceutical industry, as a result of corrupt patent regulation, drug prices are inflated, and this impacts the buyer and the patients on a personal level and a day-to-day basis. Now, first we'll talk about the Hatch-Waxman Act. So this was put in place in 1984 by Congress, and it was designed to be a comprehensive legal framework. And its purpose was to lower the price of prescription drugs by allowing generic drug companies to create generic forms of brand name drugs. To understand why this is such a big deal, we know that patents that are issued for medications mean that no other companies can also produce the same drug during the same time. But this act made it more accessible, and therefore the generic drug companies could make the exact same drugs while the patents by the original brand name companies were still alive. And the effect here is shown that before, only 19% of the industry was filled with generic drugs, and now 90% of prescriptions in the United States are from generic drugs. However, it did not directly combat pharmaceutical lobbying and competition as I intended to. I'll be moving into this really important factor now. So the impact of pharmaceutical lobbying is beyond understanding in these times, because even when the Prescription Drug Affordability Act was introduced by Senator Bernie Sanders in 2015, it would have meant that pharmaceutical companies would have been strained to submit reports on spending for research, preventing them from trying to restrict other companies, the generic drug companies, from producing their generic products. It would have been monumental and worked towards accessibility, as I mentioned before. However, because of so many companies that lobby, 14 in total, we can guess now that the bill never got passed, and another similar one hasn't been introduced since 2015. Now, in exchange for necessary treatment, patients in the US fall victim to a never-ending cycle of just paying more and more for inflating drug prices at the benefit of pharmaceutical companies only. Now, moving on to the Drug Marketing Act. We know that when we watch cable television, we have so many ads, around 80 ads per each hour of television run in America. So Such advertisements are very uncommon throughout the rest of the developed world, and they are also run shamelessly by big pharma, spooking the public into taking unnecessary medication, as now ads can influence consumers to ask for drugs that they cannot even afford, even though lower price options are already available. Now, this leads patients, especially with the images of patients recovering and living wonderful day-to-day lives that we see, patients are led to form false realities, and they believe that this medication will somehow magically better their lives. But it's evident that American pharmaceutical companies only want a lifetime of treatment, as that is more preferable to a cure, as read in our text in American Sickness. Now, one would think that a stop has to be put to this, that the American government will, stand up for this. However, we tried this in Protecting Americans from Drug Marketing Act, and the bill would have restricted companies in their advertising and marketing making their marketing costs tax deductible. However, Congress could never pass the bill, again, as influential lobbying groups fought against the legislation, and they have done this for decades. Now, we can see that as human beings, it is our right to have affordable healthcare. And to conclude, it appears as though the only way to combat big pharma and these companies is legally. Yet there are clear flaws in government regulation, and we cannot skip out on mentioning the FDA. Now, the Food and Drug Administration was actually created for this purpose, for regulation, and it was tasked with protecting the public from drug marketing and keeping pharmaceutical companies in line. In fact, that was its very purpose. And preventing companies from gaining such imaginable amounts of power over the American public that they now hold today. And unfortunately, companies were able to restrict this ability through corrupt funding and other strategies. And today we have $7.67 billion given to the FDA from pharmaceutical companies. And there's a very extreme dependency that the FDA has developed on these companies. And so we can see that because they're so intertwined, it's very hard to combat individual laws without tearing apart the entire system first. So I'd like to direct the focus on Medicare and Medicaid to Avantika now, who can discuss it in further depth.
Okay, so now we'll be talking about Medicaid and Medicare, and we can start with Title XIX. So what this title is the Social Security Act amendments signed by Lyndon B. Johnson in 1965. And as Leyla mentioned, Medicaid and Medicare are both government forms of government insurances that allow people that are disabled or people that are under the poverty line to receive health insurance so that they don't obviously account a lot of debt. And we can begin by talking about statutory eligibility, which determines who receives Medicaid and or Medicare. So under Medicaid, the children, the blind, the physically disabled, specific mentally disabled patients and others receive automatic coverage, whereas for Medicare, it's usually the elderly and some veterans. So that would cover statutory eligibility. And some have issues with this because there is a blurred line between what can be counted as a disability that would be under Medicaid. So, for example, things such as mental disabilities that aren't usually as physical, those are hard to categorize, and people who fall under those categories seem to be uncovered in Medicaid. Next, we can move on to residential eligibility. So America, 38% of America is residents, primary residents, or immigrants. And these immigrants are not covered under Medicaid or Medicare. However, they do pay taxes which go towards Medicaid and Medicare. So the question is, why do these immigrants not receive the option for Medicaid or Medicare when they are paying towards it and are contributing towards it? So although many of these immigrants fall under the poverty line and are eligible for it, the only title they do not meet is U.S. citizen. So the question is, why is it that immigrants do not usually receive Medicaid or Medicare? The next thing we'll be covering is federal government expense. So over the past couple years, and over the past couple decades, I should say, Medicaid has increased exponentially, and it increases almost 2.8% every single year, which is very, very dangerous because currently the government spends around $650 billion on both Medicaid and Medicare. So such immense expenses will only force the presidential administration to undergo cuts in other areas, which is already something that we do not want. Increasing government expenses also do not translate to the Medicaid and Medicare benefits. We are not seeing any exponential change in the coverage of Medicaid and Medicare. If we're talking about hospitals, or if we're talking about ambulatory care centers, those who receive these two insurances haven't received any benefits despite the increasing cost. Next, we can talk about the coverage gap. And the coverage gap is probably the biggest issue with Medicaid and Medicare and has become highlighted recently because of the pandemic. So what's happening here is to receive Medicaid and Medicare, you need to be under a certain line. And this depends on family size and obviously family income. So what's happening is, since there's so many people recently that have, lost their jobs and therefore lost their health insurance, they now require government health insurance, and now they're also eligible for it. However, since there are so many people eligible for government health insurance, the requirement, the annual income requirement has gone down, because obviously if there's more demand, the supply has to become, now that there's more demand, the supply is not matching. So the poverty line for the poverty requirement for Medicaid and Medicare has gone down. So now there's people in the middle of that line, which they still do not make enough to earn health insurance, but they do not make, they don't make enough also to be eligible for Medicaid. So they're not very, very poor to reach Medicaid. So they're at this, they're balancing between this gap, and they don't have any health insurance. So they're just accounting more medical debt. And this coverage gap has only become worse recently. And there's unfortunately no way to fix this, because unless we, re-ramp and people get their jobs back and companies start handing out more private insurance, the government cannot keep up with the amount of Medicaid and Medicare requests. So that covers up legal impediments, and we're going to move on in our presentation.
Hey guys, so I'm just going to do a quick conclusion to wrap up our paper. So throughout our research, it's been increasingly clear that the American healthcare system desperately needs reform. So considering all of our impediments, we must collectively pledge to do our best to educate ourselves so that we avoid bias and provide equal care to all. This might include making mandatory diversity and equity trainings, and just trying your best to avoid bias every day, especially if you are a healthcare provider. Alter the hospital billing process so that patients are no longer blindsided by the cost of their services. This would allow patients to prepare themselves to pay their astronomical medical bills if they do not have insurance, and and hospitals offering clearance on their prices would allow everybody to see the uniformity. They would have to make the hospital's prices uniform, which they aren't in most situations. We should offer reduced price options for those who cannot afford the astronomical prices of their medical bills, even if they do not have insurance, because it is unfair to put somebody in debt over one hospital stay, and make insurance more accessible to all, because everybody needs insurance and everybody needs healthcare. Healthcare is a human right and should be treated as such. Healthcare should not be treated as a business.
So I just wanted to run down everyone that came as a guest speaker through our entire cohort, and we just wanted to appreciate them and thank them for all the time they dedicated for us and how far they helped us get in the entire process. So thank you, Connie Whitman. Connie was an absolutely amazing guest speaker who came in and helped us unlock our stronger and weaker working capabilities. After taking her personality test, We were able to identify the type of learning and worker we were, and alongside Connie, we were able to identify our weaknesses, which played a crucial role down the line when assigning tasks for a final essay. As well as that, I would like to give a special thank you to Christy Snodgrass. Christy was also an amazing speaker who came in, and from her first-hand experiences in the healthcare industry. As a former nurse, she had several personal experiences, making it an even better experience when meeting her. She is an activist, and we were also able to gain insightful information from her, and a majority of us continue to follow her on her socials, such as Instagram and TikTok.
The next thank you will be to Dr. Laura Hazelton. Dr. Hazelton was a wonderful mentor and truly helped us decipher the definition of health inequality and its effects. She spoke about her own personal experiences and explained to us how the medical field doesn't really help as many as it should or as it could. Overall, Dr. Hazelton was kind of a wake-up call for us, and she really helped guide us on our path of writing our framework. Next, we have Mr. Bruce Waltuck. Mr. Waltuck's a professor at Keene University, and he was one of our first presenters. He personally introduced us to how to decision make and the different systems that exist regarding proper conflict resolution, leadership, and team management. So thank you, Mr. Waltuck, for helping us with deciding how to choose our specific topic. Next, we have Ms. Valerie White. Ms. White introduced us to one of the most important research topics in regards to health inequality, and that is systemic racism. She helped us understand how systemic racism is a very important topic and how it is vital to breaking down health inequality. And in this way, Ms. White was very helpful.
And my next thank you will be to Dr. Ruth Ann Russo. So Dr. Russo was an extremely nice guest speaker, and as a professor from Keene University, her knowledge and guidance was extremely informative, and her presentation was extremely in-depth, assisting us in our writing.
Okay, so next we have Dr. Bok Jong. Dr. Bok was a wonderful professor, also from Keene University, who introduced us to the process of question asking. He was very funny and engaging, and through his presentation, he pivoted us into the right direction regarding our framework question. Dr. Bok, we all specifically remember a picture of a chicken and a road, and that was just like a wonderful activity, and you were a great mentor.
So next we have Dominic Mingasi and Chris Seifert. So both of them were such pleasures to come in and guide us. They're the most outgoing personalities and were so energetic to the entire duration of the meeting. It was extremely interactive and such a fun experience to meet them, get to know them, and it was an amazing experience. So I wanted to especially thank them for that. And
next we have Matt, which Vaanya was.
Yeah. So okay. So Matt, we wanted to give you an extremely special thank you. Since Matt has worked with us the entire cohort, he has joined all our meetings, he has guided us from step one, day one, and he has helped bring us this far. He's one of the most amazing people to work with the entire duration of our project. He created a fun environment for us here at TCTP, and he has provided us with valuable feedback in all aspects of our work. And without him, we wouldn't have come as far as we have. Matt, I can say for all of us that we appreciate you so much, and that we all thank you for all of your help. So thank you so much for that.
We love you, Matt.
Yes, we do, Matt. And if everybody could unmute real quick and give a quick round of applause for Matt, that would be great.
Thank you, Matt.
Thank you, Matt.
Moving on, we have Miss Kelly Nagel. Miss Nagel was one of our last presenters and helped us with editing our essay quite a lot. Miss Nagel is also the host of the podcast that I showed before with Dr. Halbert on it, and this was a great testimonial. So thank you, Miss Nagel. And then last week we have Dr. B, who introduced us to economic impediments, and he was quite a character, and he was really funny and nice, and he showed us his point of view in the hospital. So thank you to Dr. B.
With that being said, we do have an award to give out. So we have had the pleasure of speaking with thought leaders, educators, advocates, and activists. And I know that all of us admire that field of work and want to go into it someday. In recognition of the work these individuals do in the communities we're trying to impact, we have set up the Community Impact Award, which awards a $500 donation to an individual organization that we believe have a tremendous impact not only on our research, but also society as a whole. This session's Community Impact Award goes to Dr. Laura Hazelton of Impact in Healthcare, a nonprofit that focuses on interdisciplinary medical and patient alliance for care transformation. So congratulations, Dr. Hazelton.
As they say in Hollywood, Dr. Hazelton could not join us today, but she has sent us a video message.
Hi, Team Think Tank. It's Laura from Impact. I just wanted to come by and say thank you so much for honoring us with the Community Impact Award. It means so much to us that you felt so strongly about our chat about social determinants of health. I really enjoyed chatting with you guys. You guys are so smart. You guys are going to make so much change to the healthcare system and to whatever you end up doing with your careers in the future. I honestly really enjoyed our conversation, and I'm so glad to see that so many people care so much about making a difference and that you guys are starting on your work in this field so early. I'm sorry I couldn't be here tonight. I ended up having a class, but I just want to say thank you again. If you need anything from us, if you want to chat, if you want to talk policy, if you want to get involved with Impact, anything like that, you can email impact@hello@impactinhealthcare.org, or I think most of you have my personal email, so feel free to reach out if you need anything. And I'm really looking forward to seeing what all you guys accomplish in your careers. Thanks.
All right, thanks, team. Really appreciate that. Great job. Just very quickly before we move on to other matters, I know that a great number of our audience members are members of the healthcare field or healthcare industry. And I would encourage you to check out Dr. Laura Hazelton and the Impact in Healthcare nonprofit. It's an interdisciplinary organization that is advocates in reform for healthcare workers and patients. And they are a grassroots organization that looks for volunteers, specifically in the healthcare industry, that can help in specialized areas. So if you are a member of the healthcare industry, I encourage you to check her out. This cohort thought enough of her and her organization that they donated $500 to her. So I would say that that is a seal of approval from the Teen Think Tank Project. But we are not done giving out awards. Every cohort, the Teen Think Tank Project awards a $500 scholarship to the research cohort member that best exemplifies what it means to be a research associate in our program, a teen change agent, an individual who is in search of their why. And it's very difficult because we've assembled a group of high potential teenagers. Every single one of them is college bound. Every single one of them is AP honor track high school student. Every single one of them is a student leader. I mean, for goodness sakes, we spent a half an hour dissecting the state of healthcare in America. At least 5 minutes of that was spent on the Hatch-Waxman Act. If you don't get goosebumps when teen change agents can dissect the Hatch-Waxman Act, you're not American. That is the type of student, that is the type of teen we work with, and it's very difficult to find just one to provide a scholarship to. That is why I don't do it. It would be nearly impossible for me, and we would be broke by the end of the quarter if we were to award a scholarship to every single one of our members. That is why we get our partner and sponsor of the Teen Think Tank Project's scholarship to choose that individual. And that individual is Mary Pasquarella from Perennis Financial Planning, who had the opportunity and the honor to discuss and interview our scholarship finalists, who are Vaanya, Keara, and Riya. Mary, are you there? The floor is yours.
All right, great. I have to agree, Matt, wholeheartedly. I have goosebumps on my goosebumps. Being able to listen in tonight and listen to all those great presentations, I mean, totally impressed. And as a financial planner, I have to agree. Client is a big consideration because as people get older, it's like something we have to actually physically plan for with especially with retirement planning. So, I mean, this topic is not only timely, but a topic that does need more focus and more attention, you know, as a society. As Matt said, I had the opportunity to interview 3 amazing candidates. This was a really hard decision because all 3 submitted excellent essays and had wonderful insights. You know, being involved in Teen Think Tank, I am always amazed at the level of intelligence and the articulate responses that I receive in the interview process of all the candidates. It gives me such hope for the future, the next generation, and of our country. So it is with great pride that I announce that Riya Mehta is the recipient of this cohort's scholarship program.
I'm really honored to receive the scholarship. This experience has been like truly enlightening, and it was so much fun working with all of you like these past 2 months. And I've learned so much about like myself and, you know, like better communication. I've definitely increased my confidence over these past few months, and it's really been like really exciting to work with you. And I think this experience will continue to motivate me to be an agent of change in the future.
Well, congratulations and best of luck to everyone who took part in this cohort.
Thank you very much, Mary. Much appreciated.
Anytime, Matt. Always a pleasure.
So before we conclude, we always think that it's a good idea to connect our cohort and our panelists with the individuals who are interested in hearing what they have to say. So what we'd like to do is open up the question and answer period by bringing back our good friend and Teen Think Tank project compatriot, Kelly Nagel.
Great, thank you. Congratulations again to all the members of the cohort. Just really brilliant work, and it's amazing to watch you work and listen to the results of your thoughtfulness and your analysis. We cannot wait to see what you're going to be doing in the future. And also a great big thank you to everyone who joined us this evening, taking the time to learn from the next generation of leaders and also your support of these really brilliant students. It's very much appreciated. We'll start the Q&A with some questions that we already have for our cohort members. But while you're listening, if you could put some questions in the chat, that'd be great. We'll be getting to them as well. I am going to start our first question aimed at Keara. So Keara, you spent 3 months investigating a variety of impediments preventing the achievement of equitable access to healthcare in America. You participated in a research paper outlining those issues. So after all of that, what is your biggest takeaway from this process?
My biggest takeaway from this process is definitely when we look at solutions towards social issues, not only in healthcare and basically any industry, there's never one direct thing we can do to yield that solution. It's either going to be a series of things that you do that takes you to that solution, or multiple things at once.
Great, thank you so much. Our next question is about insurance, and I'm going to ask Avantika to answer this. How do insurance procedures hinder patient well-being?
Oh, so as I mentioned before in the video, what insurance does is it kind of sends doctors in a loop. So when doctors say, I have this patient, she's coming with this, this, and this, and I want to prescribe this to help her out, insurance tends to go for the cheapest option for them. And what happens is, even if the doctor doesn't agree with this cheapest option, they're forced to prescribe it. And when this option doesn't work, the cycle happens again, and the patient has to come in again, and they have to send out another request. Insurance will be like, oh, before you prescribe this, try this. And then they keep on going from these, after these tiers of medications, until they finally reach what the doctor wanted to primarily prescribe. So it not only in the end, it ends up being more expensive. The time the patient suffers is longer, and it's more expensive for the patient in the end because there's more doctor's visits and the doctor's time is wasted. So yeah, that's basically what happens.
Great, thank you for that. Vaanya, next question is for you. For those interested in pursuing a career in the medical field, did your research affect your perception on what type of career you'd be pursuing?
So as someone who does want to pursue a career in the medical field, yes, our research did affect my perception of what type of career I'd be pursuing. I learned that healthcare isn't fair, and due to all the inequalities based on race, gender, ethnicity, and all that stuff we talked about in social impediments, I was encouraged that the type of career I may be pursuing may be one where I can travel and I can help people all throughout the world. Or, perhaps a gynecologist who helps women since they are one of the minorities. Or maybe learning in a new country and then working there because I can help out, all throughout. So I do feel that based on our research and then understanding the different laws and then the economic impediments, then it did make me wonder what type of career I wanted to pursue and how I could help society the most.
Well, I think I'd like to start that off with how we grew as individuals, as researchers. We came together and collaborated with much of the knowledge that we had acquired over the lengthy process of writing our own research papers. And when we compiled all the information that we had and everything that we learned, we could really say that we came far from the literature reviews that we first had written, and now we ended up with answering our own research questions. So I think looking at individual growth and development and putting that all together with growth as a group really just demonstrates how far we have come and just how much we were willing to put our all into the work that we produced.
Great, thank you. Jeyven, I have a question for you. Since you're from Canada, wondering if you could speak a little bit about healthcare in Canada and what's your impression of American healthcare?
Yeah, totally. So in Canada, it's a general assumption that we have a public free healthcare system. What I've been told, through teachers, through peers, is that America's a privatized system. You have to pay, for your healthcare. You can have insurance that'll cover some of it. That's all. That's only the real impression that I had. Going into the teen think tank. I was kind of clueless about the American healthcare system, and then as I, developed into it, I learned that I was, much more complicated, than it appears on the surface.
I'm going to put this question out to the group, and feel free to unmute and answer it. Do you think that there's hope that we can reform America's healthcare system? Give me a yes, you can give me a no. You can elaborate on your answer. I'm curious how you would respond to that.
I feel like there is hope in our healthcare system reforming and that we can make a change. After learning about all of this, we are the next generation. So if we know about what's going on wrong, we do have hope to, change that. And more than that, together we can all work to essentially fix the healthcare system, but also improve it. And then understand, gain more information, understand where exactly it is we're lacking and what exactly it is that we can do better. And that, if more people get to know about the work we do, the healthcare inequality, then more people will understand. And I feel that more people will take action. So it's more about spreading that awareness. And then there is hope.
I'm a firm believer that the next generation is going to be the strongest advocacy generation for things that they believe in. And I think that once we're kind of, the people in charge, there's definitely hope that we are going to make a change. Because I know there's still a lot of older people in charge who may not believe in completely reforming systems and things like that. So I think there's definitely hope with the new generation that we will make a change in the healthcare system so that it's more fair for everybody.
I completely agree. And I think that especially just seeing the like-minded individuals in our group, I have plenty of faith in the next generation.
I think that there is hope, and we can definitely see change if the healthcare industry starts to emphasize more care, and we kind of bring back our system to what it originally was before we started prioritizing profits. And I think that with this new generation, as Gianna and Avantika said before, we will start to see that change.
And another question for the group, again, please feel free to unmute, but very general question, how was your experience with the Teen Think Tank project? Reflecting upon it, what comes to mind?
I think it was certainly like very valuable, and like I learned a lot, especially about like writing research papers and editing, and like learning how to take criticism from other people is really important. And I think I learned how to do that, like, and take things in stride and work on my work.
I really agree with Mitch. Like, it was really educational, and like it was really motivating to like seeing people who have the same ideas as yourself and like working with them, twice a week. And it was really fun.
I felt that it was a really unique experience. Also, meeting with everyone, collaborating with everyone, that also gives us the teamwork that we need to succeed in the future. So, yeah.
I agree. I think that this program has honestly helped all of us so much, because I know that most of us want to go into science or political science or something of that nature. And it really exposed us to real academic research, and just working together collaboratively with a group that we maybe like don't know each other. I didn't know anybody before this. And yeah, I just think that it was very interesting and enlightening to learn about healthcare with a bunch of people that I didn't really know. And now we're all like friends, and we just all work together to make this whole culmination of research.
Great, thanks, Gianna. Any other reflections? Great, well, thank you all.
Thank you, Kel. Team, I have one final question before we go. It's specifically for Keara. Keara, 12 weeks ago, we started this process and you were just a novice crocheter. 12 weeks have gone by. Have you gotten up to a sweater or a scarf or maybe even a pot holder yet?
I actually attempted to do a bucket hat. And I got pretty far in it, but then I stopped because I didn't like how it turned out. But I did learn 2 new stitches, and I learned a new technique. So I'm definitely getting somewhere.
Well, listen, if your summer's not too busy, we are looking to launch a Teen Think Tank Project merch store. And I think a crocheted bucket hat would probably be our top seller. So if you're up for the task, set aside some time for this summer. We'll look forward to it. We don't just solve the world's problems here, folks, at the Teen Think Tank Project. We also crochet. So thank you very much. I'm going to turn it back over to the team for final words, thank yous, and goodbyes.
Okay, well, thank you everyone for coming and spending your time with us. We spent a lot of time over the past months preparing and researching our paper, and it was really awesome that everyone could come out and we could show it to you guys. And I think, however, it is time to say goodbye. Goodbye.
Bye. Bye.
Bye, guys.
Goodbye, guys.
Thank you all.